Today, we will begin Module 2, Part 1, where we will explore the healthcare delivery system in India, its evolution, the current landscape, and the challenges that impact accessibility and quality of care. We will also discuss the critical role of nurses in healthcare delivery and why digital health is essential in overcoming these challenges. So, let us get started. Myself, Lieutenant Colonel Jilmiana Jose, presently working as professor at College of Nursing, INHS Ashwini, Mumbai, under Maharashtra University of Health Sciences. During the last 20 years of my service, I got opportunity to work as clinical nurse and nurse educator at various defense establishments. The topics that will be covered in this particular module are Introduction to Healthcare Delivery System in India, Emerging Challenges in the Indian Healthcare System, Introduction to Digital Health as a Solution, and Role of Nurses in Digital Health Adoption. By the end of this module, you will be able to gain a deep understanding of India's healthcare journey, how it has evolved over time, and where it stands today. We will uncover the key challenges and emerging issues that are shaping the future of healthcare delivery in our country. And finally, we will explore the exciting world of digital health and how it is transforming the way we approach healthcare challenges. We have structured this module into three parts. In part one, we will introduce the healthcare delivery system in India, trace its evolution, and examine the current healthcare landscape. We will also discuss the crucial role of nurses in delivering healthcare services. Finally, we will explore the emerging challenges in the Indian healthcare system. Let us dive deeper into each of these topics. Introduction to healthcare delivery system in India. India is a vast and diverse country with a population of over 1.4 billion people. Yet the healthcare system is supported by only 4.6 million healthcare providers like doctors, nurses, and midwives. With a density of 33.5 per 10,000 population. As we all know, health is a state subject under the Indian Constitution, with state governments responsible for managing healthcare services. Uneven resource distribution and economic differences between urban and rural areas contributes variation to access and quality of healthcare across the regions. To meet the evolving needs and challenges of this growing population, the health system has been consistently changing. In this context, digital health is emerging as one of the fastest growing solutions to address these critical healthcare needs. The healthcare system in India has evolved over centuries, blending ancient traditions with modern advancement. Key milestones which helped us to evolve include the Bohr Committee report of 1946, which recommended a universal healthcare delivery system with focus on primary health centers. In 1983, National Health Policy strengthened and expanded rural health services. In 2005, National Rural Health Mission strengthened rural healthcare infrastructure, including PHCs and community health centers. 2017 National Health Policy aimed for universal health coverage and better healthcare access. It also focused on preventive healthcare services. In 2018, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana launched the world's largest health insurance scheme covering 500 million people. In 2022, Ayushman Bharat Digital Mission created unique digital health IDs for patients to store and access medical records. Healthcare delivery system in India is constituent of public healthcare and private healthcare in both rural and urban areas. Public healthcare organizations are network of facilities administered by government and public entities with the aim of providing affordable healthcare services, especially to the economically vulnerable and underserved populations. Whereas private healthcare includes hospitals, nursing homes, clinics, etc., which are owned or managed by for profit organizations or non for-profit organizations. As per the National Family Health Survey 5, 48.2% of Indian household members generally use private sector health facilities when they get sick, whereas 50.1% of the household members use public healthcare facilities. We all know nurses are a critical part of healthcare delivery system. Have we ever tried to analyze the role of nurses in the healthcare delivery system of India? So the role of nurses in healthcare delivery system in India. Nursing personnel perform essential tasks across various healthcare settings to meet diverse patient needs. Nurses play a crucial role in patient care management by administering medications, monitoring vital signs, performing health checkups, providing counseling, health education, and ensuring overall patient well-being. In community health care, nurses extend the services to rural areas, promote preventive, promotive, and curative care, and conduct health awareness programs to improve public health. Nurses contribute to hospital management by maintaining patient records, managing inventory, and ensuring quality checks and supporting the smooth functioning of hospitals. Nurses are actively involved in research and education, exploring healthcare advancements and contributing to medical knowledge. Nurses also train and mentor future nurses, serving as educators in nursing schools and colleges. Nurses take on leadership roles in hospitals, healthcare institutions, and policy making bodies by managing teams, implementing quality care standards, and improving patient outcome. They play a crucial role in advocacy by ensuring patient rights, advocating for better healthcare policies, and working towards improved working conditions for healthcare personnel. Nurses contribute to shaping national healthcare by participating in policy development, leading professional associations, and driving public health initiatives. As per the Indian Nursing Council records of 2022, India has a nurse to population ratio of 1.7 nurses per thousand people. Given the vast population of India, adopting digital health is essential to enhance healthcare accessibility and efficiency. Now we will learn about emerging healthcare challenges in India. Let us take a moment to identify the key challenges that we have noticed which prevents us from providing quality and coordinated care to all patients. India's healthcare system faces multiple challenges that hinder the delivery of adequate and quality care to meet population demands. These challenges emphasize the importance of a well equipped healthcare system where nurses, as frontline caregivers, can contribute effectively to patient care and health promotion. The challenges span long-standing issues such as lack of awareness, inequitable access to care, and resource shortages, as well as emerging concerns like shifting disease patterns and out-of-pocket healthcare expenses. Health awareness in India remains low across various population groups. Limited awareness of healthcare delivery system, such as underuse of telemedicine and preventive services leading to increased hospital visits. Lack of knowledge about healthcare financing programs such as Jan Aushadhi and Pradhan Mantri Jan Arogya Yojana, leading to higher out-of-pocket medical expenses of the people. Lack of preventive care knowledge, such as importance of regular screenings and vaccinations, results in unnecessary hospitalizations. In India, access to healthcare is a complex issue that is influenced by various factors, including geographical factors, financial factors, and socio-cultural barriers. The geographical barriers are poor road conditions, long distances, there's a lack of transportation, and inadequate network connectivity, making reaching healthcare facilities difficult. Over 70% of Indian population lives in rural areas where access to preventive and curative health services are limited. In financial barriers, we can see that India spends only about 1.5% of GDP on healthcare, leaving individuals to bear 63% of health expenses from their personal income. At least 30% of the population, approximately 40 crore individuals, lack health protection through insurance, exposing them to financial risk. With 70% of Indians residing in rural areas, limited incomes and rising healthcare costs restrict their ability to access services. Social and cultural barriers like discrimination based on socioeconomic status, caste, and cultural norms often limit access to equitable care, further compounding health inequities. Marginalized communities like scheduled castes and scheduled tribes face higher child mortality rates and lower immunization rates. Women in poorer communities face greater health risks. For instance, the prevalence of anemia among women increased from 53.1% to 57% as per NFHS 5. Resource shortage is a major challenge resulting in shortage of man, material and money. Healthcare professional shortage. India has only 9 physicians per 10,000 people and 24 nurses per 10,000 people. India needs more than 13 lakh nurses and midwives and 1 lakh physicians to fill the shortage. Healthcare facility shortage. India has only 1.3 government hospital beds per 1,000 population. That is far below the WHO recommendation of 3 beds per 1,000 population, highlighting a critical infrastructure gap. India's government spending on health is 1.5% of GDP, which is one of the lowest in the world. 30% population is uncovered under any insurance scheme and depends on the personal income or out-of-pocket payment. The NSS 75th round report highlights the high cost of medical treatment in private hospitals in India. According to this report, the average cost of hospitalization in a private hospital is around rupees 40,000. For chronic diseases like cancer, hospitalization expenses can go up to rupees 1 lakh. For cardiovascular diseases, the cost of hospitalization can be around 60,000. These expenses are significantly high, making it difficult for a large section of the population, especially those from lower socioeconomic background, to afford quality healthcare. Government policies like Ayushman Bharat, Jan Aushadhi, and Janani Suraksha Yojana are some of the examples which are helping the Indian population to reduce out-of-pocket expenses in the healthcare expenditure. Coming to the next challenge, the shift in disease burden. Earlier, we have seen that the communicable diseases were in a high rate, but now we have shifted to non-communicable diseases. The proportion of death due to communicable diseases has steadily declined, while death from non-communicable diseases have shown a consistent rise. Non-communicable diseases related death rose from approximately 3,000 per million in 1990 to nearly 4,500 per million in 2019, which emphasizes the growing burden of lifestyle related conditions. And these non-communicable diseases are estimated to account for 63% of all deaths of the country. To summarize, we have now completed the part 1 of module 2, where we explore the healthcare delivery system in India, its evolution, the current healthcare landscape. We also discussed the critical role of nurses in healthcare delivery and highlighted the emerging challenges in the Indian healthcare system. Next, in part 2 and 3, we will dive into digital health, its benefits, how it addresses key healthcare challenges in India, and the crucial role of nurses in adopting digital health solutions. Thank you. I congratulate you for completing Module 2, Part 1, and it's a great job. See you in the next session.